Once again, welcome back to our channel Ach'z. So today we had OET exam. So here comes the complete review of today's OET exam. So we are going to discuss about all the modules. That means listening, reading, writing and speaking, available question booklet which we collected from different centers. So if you got any other question booklet, means try to mention that below along with the center name. Then it will be easy for other students also. Because question papers are always different based on the time zone. So let's start with our section. Coming towards the first module, as usual, reading. The first set of question booklet, the part A including epidermolysis bullosa. So EB, we can call it as EB. The test A including the definition and types of EB. Test B with the signs and symptoms, and test C wound care management strategies, and test D family support and psychological care. It's a type of skin condition. So in our preparation guide, each and every test date based, we are releasing the preparation guide. For 10th May also we released weeks back. So if you watch that, means I hope you are clear about it. Based on the things which we mentioned in the video, like that only the entire question booklet. So I'm so proud about that. I clearly mentioned that you need to concentrate on the skin conditions for reading module, and the cardiac conditions they can ask for, then the surgical conditions they can ask for. So these all are the things I mentioned. Seem like that though from different centers we collected the question booklet, and it's completely based on that. So here epidermolysis bullosa, it's a type of skin condition. In that, the C1 and C2 including infection control policies and instruction for applying these bandages and emollients, and also about the advances in the nursing care. So that's about the first set of booklet. Coming towards the second set. So part A including total hip replacement. In that, the test A about the description about the condition, test B about the causes of hip pain, test C about the pre and post surgery, and test D about recovery and outcomes. I think recently also in one exam the same topic was there. C1 and C2 including fall prevention and new policies. So third set of reading, Brugada syndrome. So it's a rare genetical condition which affects the heart rhythm, and it can result in this cardiac death. So here the test A section including the description and causes, B about the common symptoms and the diagnostic test like the ECG findings and all. Then C test about emergency management protocol for arrhythmiasis. And the test D about patient education handout on lifestyle precautions. In that, the C1 and C2 including hospital policy on cardiac monitoring, then nurses role in patient and family genetic counseling. So that's about the three different set of reading which we collected from students. Now we are moving towards the next set of module. So now coming towards the writing module. Again, as I mentioned in the preparation guide, all three letters coming under referral letter only. So the first set of referral letter, they just given the patient name, the background history about the type 2 diabetics and hypertension. The patient is living alone and has been struggling with foot ulcers and not healing properly. So they just mentioned the current condition of the patient, the ulcer, the diameter of the ulcer, about the infection, symptoms and all. So they just checked the blood glucose level and it is uncontrolled, and given the level of HbA1c. And to the report suggest the patient reduced the sensation in both the feet and suggesting this diabetic neuropathy. And the patient is under the strict advice on this blood sugar control and also about the food care. So due to this persistent infection and also the slow healing, she required a specialist assessment. So you need to write a referral letter to the podiatrist to prevent the complication like the amputation and all. So that's about the first set of letter. It's about the patient with diabetic and also hypertension. Coming towards the second set of letter, again referral letter only. You need to write a referral letter to a palliative care unit. They just given the address of the hospital and all for the further care and support. So patient name Mrs. Linda. They just given the detail about the DOB and all. Diagnosis is advanced ovarian cancer. So frequent hospitalization for pain and cramping. So poor appetite. Family nearby lives in aged care facility. Now the need is pain control, emotional support, and also specialist palliative care. So you need to write a referral letter to palliative care unit. And the third set of letter, again referral letter only to pediatric occupational therapist at Child Developmental Center. They just given the address of that. Concerned, the parent is concerned about the delayed speech and difficulty with this fine motor skills and also poor balance. They just given the developmental history of child. Sat unsupported at 10 months and walked at 22 months. Limited vocabulary, uses two word phrases only. Difficulty holding the items like the crayons, the spoon and all. Then in the family history, older sibling with mild speech delay. So in the medical history, there is no any significant illness or the complication, birth complications and all. So you need to write a referral letter including this developmental review, and also suggest for the assessment and intervention for the speech and also motor skills and overall development. So that's about the three different set of letter. So again, the all three under referral letter only. Again, I'm saying that if you get any other question type and all means, try to mention that detailedly in the comment box. Now we will discuss about the speaking section. Coming towards the speaking module, the first set of role play card, community health center. That's the setting. A 40-year-old trying to quit smoking. So your task is to discuss smoking risk, about the quitting strategies, and provide the motivation and support to the patient. Coming towards the second set of role play card, setting is pediatric ward. So the parent of a child with newly diagnosed asthma. So your task is to explain how to use this inhaler. It's very common topic. Advise on the triggers to avoid and to reassure the parent. Coming towards the third set of letter, we got little more informations. So the setting is surgical ward. You are talking to a patient who had a laparoscopic gallbladder removal, that means cholecystectomy, yesterday. So your task is to reassure the patient that the surgery went well and explain what to expect during the recovery period, about the pain, tiredness or shoulder discomfort from the gases used during the surgery, and advise on the activity, how long they want to take rest, like a few days, and avoid heavy lifting for 2 to 3 weeks, and gentle walking is encouraged after that. Then about the dietary advice, eat the small and low fat meals, avoid the fried items, then increase the fiber to avoid the constipation, and inform them when to seek help when they want to come back to the hospital, like if there is any fever or worsening of the pain, or is there any signs of infection, they want to come back. So that's about the third role play card. Coming towards the fourth role play card set, the setting is community health clinic. You are speaking to a parent who has brought their 2-year child for routine vaccination but is hesitate and worried about this vaccine safety. So your task is to ask the parent about the specific concerns. Then you need to reassure them that the vaccine are safe and it is tested thoroughly. And you need to explain about the side effect like the mild fever or soreness, and emphasize the importance of vaccine in preventing the serious illness like mumps, measles or rubella, polio, the importance of that. Then clarify the misinformation they have heard from others and offer the written information or a chance to speak to the doctor if they want. So you need to encourage to ask more questions and clarify their doubts, and encourage or to reassure the parent. Okay, and the next one, next role play card, the setting is respiratory outpatient clinic. So the patient with COPD, chronic obstructive pulmonary disease, who has been referred to diet advice or diet education. So your task is to ask the patient about the current eating habit or about the weight changes. Based on the patient is underweight or overweight, based on that only you need to give advices. So explain the importance of a healthy diet in managing these respiratory conditions, like helps to maintain the energy or the muscle strength, especially respiratory muscles. and prevent the fatigue or reduce the breathlessness. So you need to recommend small and frequent meals because a large intake of the food can cause some breathing difficulty again. And recommend the high protein, high calorie food if they are underweight. Then if they are overweight means you need to suggest the weight management strategies without causing any fatigue, and also adequate hydration. So caution about this gas producing food items like the beans or the fizzy drinks and all, it can worsen the bloating or discomforting patient. So you need to refer to a dietitian if needed and answer to all the concerns. And the last role play card, it's home visit, community health nurse visiting the elderly patient at home who recently had a minor fall but was not seriously injured. So you need to ask about how the fall happened and to reassure the patient it is common. Then advise on this fall prevention strategies, and you need to suggest to check out their vision and also check out or review their medication that causes any dizziness and all, and encourage the regular gentle exercises or the balancing exercises. And again, you need to offer the referral to the physiotherapist or the occupational therapist if needed. So that's about the 6 different role play card scenarios which we collected from today's exam. And now we will discuss the last module, listening section. So in that, the set 1, the part A includes the talk by a dermatologist to a patient about eczema, and in that the B part including talk about fire safety and all, and the C part it's a presentation on mental well-being. Coming towards the second set. So if I'm saying like first set, second set, don't be confused that you will get different sets in your exam. As I mentioned before, we collected from different centers. So we are discussing all the available question booklet. Okay. So the second set, in that the part A including talk by a gynecologist about PCOS, and the B part talk about aggressive behavior, and C part about the stroke recovery. And the third set, the audio part A talk by a gastroenterologist about the food poisoning. B part, it's the communication based on the new equipment training, and the C part about the wearable health devices. So that's about the presentation at the last portion. So I hope you all attended well. As I mentioned before, if you got any other question booklet means try to mention that clearly in the comment box along with the country or the center you given your test. So all the very best for your future and especially for the results. I hope you will get to the desired band score and you can achieve your dream. So once again, thank you for your time over here. And for next test date, it's on 24th. We will release the preparation guide as soon as possible by 2 to 3 days. Within 2 to 3 days, we will release that. So try to concentrate on the topic we will discuss during the preparation guide. So it will really help you out in your real exam. So we will come out with the preparation guide or the ultimate guide for May 24th as soon as possible. So once again, thank you for your time and do subscribe and support us if you find this video so useful, and recommend to your friend who are preparing for OET exams. So once again, God bless you all and thank you.